In the complex world of modern medicine, our greatest battles are often fought against enemies we cannot see. One such adversary is a bacterium known as Clostridioides difficile, or Cdiff for short. This is not just a simple stomach bug, it is a serious and sometimes life-threatening infection that can cause severe diarrhea, inflammation of the colon, profound distress for patients already grappling with other health issues. When we talk about patient safety, we must talk about Cdiff. It represents a significant challenge within hospitals and other healthcare settings where vulnerable individuals are concentrated and transmission risk is heightened. Understanding this threat is the first, most critical step in defending our patients from the harm it can cause. The impact of a Cdiff infection on a patient can be devastating, extending far beyond the physical symptoms. Imagine already feeling weak from another illness or surgery, and then being struck by relentless, debilitating diarrhea. This condition, known as colitis, can lead to dehydration, kidney failure, toxic megacolon, a hole in the intestine, which are medical emergencies. For our patients, this means longer hospital stays, more complex treatments, and a significant emotional toll. Their journey to recovery becomes steeper and more fraught with complications. The presence of Cdiff turns a place of healing into a potential source of further suffering, a reality we must confront with unwavering resolve and deep compassion. Preventing the spread of Cdiff is not a task for one person or one department. It is a shared mission that rests on the shoulders of every single individual who walks through our hospital doors. From the most experienced surgeon to the dedicated environmental services staff member cleaning a patient's room, everyone has a critical role to play. Doctors, nurses, therapists, technicians all interact directly with patients, and each touchpoint is a potential moment for either transmission or prevention. When we see patient care as a team sport, we understand that our collective actions create a shield of safety. This shared responsibility is the bedrock of a culture that prioritizes the well-being of every patient above all else. Certain individuals are at a much higher risk of contracting Cdiff. The most vulnerable are often older adults, especially those over 65 who may have weaker immune systems and other underlying health conditions. Patients who are on long courses of antibiotics or have recently undergone gastrointestinal surgery are also at significantly increased risk. Furthermore, individuals with compromised immune systems, such as those with inflammatory bowel disease or cancer patients undergoing chemotherapy, are particularly susceptible. One of our most powerful defenses against Cdiff is remarkably simple: proper hand hygiene. However, it's important to know that alcohol-based hand sanitizers are not effective against Cdiff spores. This is a crucial distinction. When caring for a patient with a confirmed or suspected Cdiff infection, the gold standard is to wash hands vigorously with soap and water. The friction from scrubbing physically removes the spores from the skin. Similarly, wearing the correct personal protective equipment is non-negotiable. Gloves, gown. This creates a physical barrier that prevents the spores from contaminating our clothing and skin. It stops us from carrying the germ to another patient or area of the hospital. This brings us to the concept of antibiotic stewardship, which is a cornerstone of Cdiff prevention. Stewardship simply means using antibiotics wisely and only when they are truly necessary. It involves appropriate selection, it involves correct dosage, it involves appropriate duration. Every time we prescribe an antibiotic, we must weigh the benefits against the risks, including the risk of causing a Cdiff infection. When a Cdiff outbreak occurs or a complex case arises, we turn to the expertise of an infectious disease doctor. These specialists are like detectives, trained to investigate the source of infections. They understand transmission patterns. They guide the overall response. The infectious disease doctor plays a vital role in managing patients with severe or recurrent Cdiff. The treatment for Cdiff focuses on two main goals: stopping the infection, restoring the health of the gut. The first step is often to discontinue the antibiotic that may have triggered the problem, if possible. Then, specific antibiotics that target Cdiff itself, such as oral vancomycin, are prescribed. Fidaxomicin. For patients with recurrent infections, a more advanced therapy like a fecal microbiota transplant may be considered. This procedure introduces healthy gut bacteria from a donor to repopulate the patient's colon and restore its natural balance. These treatments, guided by expert medical care, offer hope and a path to recovery for patients suffering from this challenging condition. Ultimately, our fight against Cdiff is an act of profound kindness and empathy. We must always remember the human being at the center of our efforts, the patient who is scared, the patient who is uncomfortable, the patient who is relying on us for safety and recovery. A Cdiff diagnosis can be isolating. Patients are often placed in contact isolation, limiting interaction with family and staff. It is our responsibility to ensure they feel cared for and not forgotten. Taking the extra minute to wash our hands thoroughly, taking the extra minute to properly put on a gown, taking the extra minute to put on gloves, these actions are more than rules, they express our commitment to protecting the vulnerable. This is a call to action for every member of our healthcare team. Commit individually and collectively to unwavering compliance with infection control policies. Read the policies. Understand them. Follow them every single time with every single patient. Do not cut corners. Do not assume it's okay just this once. Consistency is our greatest weapon. Hold ourselves and each other accountable. Our unity is our strength in this fight.